Thank you. Hello, everyone. It is really exciting for me to be here this evening, although it's virtual, but I feel that, we're kind of used to this now after COVID. And what a good way to be able to reach out to many people and be able to connect. I am going to talk about this new all-issue laser. It's a 9.3 micron laser. Very, very excited to share about this because the little pun of the title I love because it is the new wave, but it's also the new wavelength that we're actually looking at. So as I'm talking about any of these things that I'm sharing with you, if there are any questions or if there are anything, I mean, this should be very much of an open thing. So please let me know, put it in the chat or something like that. Then, we can certainly talk about it in between or at the end, whatever works out for you. But my goal for today actually is to make sure that you're hearing about this and then you're actually able to know what this is and being able to know what this can do for you as well, because obviously it certainly was a game changer for my practice. So just to little bit about myself, I'm a general dentist practicing out of Morgantown, Pennsylvania for about over 25 years now. And or is it that much? I am. Love it. Love obviously for it. But one of the I really love is being able to know how technology can really pivot, how I can pivot technology in my practice. So it's been really amazing for me to know that that's what I can do. And it's exciting for me to share that this technology that I'm about to talk about has became such a game changer in my practice. And I'm hoping that this is something for you too. So let's say where we are with technology. Obviously, we live in it. We're seeing that evolve, the evolution of technology. We're always living with it. So I always talk about, even just that phone that we have, like the little phone that I know that I'm not going to be able to live without right now. Even like iPhone is now what, 15 or something like that. 15 years ago, it didn't even exist. I mean, I remember when I was doing my residency, I was really carrying this like the big briefcase looking cell phone that costed like $20,000 that my life depended on it. I didn't want to lose it kind of thing, or carrying around coins in order to find the pay phones and things. We don't even think about those anymore. And that's kind of the same thing in dentistry. Dentistry have changed a lot over the years, but I think we still have the core of the dentistry of what we do is. So I always kind of start my presentation of this way. So 20 years ago, even 25 years ago, if you had something called ventricular septal defect and you have to get the defect restored, it is actually a physical open heart surgery. Open up the rib cage, get in, restore, and then repair, and then they kind of get you put back on. Ribs, you just have to immobilize yourself. So 3 to 4 months of nothing at that point. You just have to be immobilized and let everything heal. That same procedure that you have to get done today, they go through intercostal. It's an outpatient, and you're in and out, and you have a very minimal downtime. So I feel that that's the same way in dentistry. We're still doing the same thing. We're controlling the disease. We're making sure that we're controlling the infectious process, decay prep, the cavity is still there, resin restorations, whatever we're doing, we're still doing the same thing. It's how we're doing has changed. And then that in itself changes how things we're doing and then how patients are perceiving and how that efficiency that comes with it and then accuracy and also the quality of the work that we're going to produce gets dictated by the technology we're going to evolving. So I always say, like, we can still do the same way. Dentistry can be still done the same way. You can still use the same loops and belt type of a chair that you have in your office. Hopefully don't. But the thing is, nowadays, everything has changed, technology has evolved, and I think people expect that to be something that we're providing for the patients. And then that comes to the actual doing dentistry. We're moving away now from that whole drills and whatnot, and then we're kind of getting into this laser dentistry. So it's kind of interesting and exciting. Obviously, the laser dentistry has been around for a while. It is actually trying to find that right wavelength that actually works for what we're trying to do. So when we're looking for the all tissue laser, we have to make sure the wavelength of laser really gets into the area of the chromophores, what we are actually absorbing those laser energy to be present in abundance. So that way it's actually working really well. So if you have worked with the lasers before that doesn't seem to really work and doesn't seem to quite cut or doesn't seem to do what you're expecting it to do, it's probably because the wavelength of the laser is not quite suited for the things that you want it to do, or not having to be aligned with the chromophore that you're actually working with. I think you're going to notice that how this all tissue laser that we're going to talk about is actually delivering that. So when you're thinking about doing any type of technology installation to your practice and implementation, you have to think about this. What does it do for me in terms of the growth of the practice? In terms of how does it affect me to be able to do better dentistry? How does it make it more efficient? Because you want to get an ROI there too. And then when we talk about ROIs, then what kind of new procedures can I do and how does it get incorporated into everything? So this 9.3 micron laser is actually going to be able to hit all these areas and being able to affect all those spots, which is really kind of cool because I think it's the only technology that I know that I have introduced to my practice that actually does hit everything. You're going to see the patient growth with this, which obviously in turn is going to lead into the practice growth. You're going to actually become a better dentist because you're having a better tool to be able to do things better that's minimally invasive, minimal post-op discomfort, and just having that soft tissue management that you can do with the rapid healing, that in itself is going to really propel what you're doing to the next level. And then not to mention, because it's able to do that no injection and anesthesia-free dentistry for you, of course, increasing efficiency, of course, being able to do more in a set given time, and of course, being able to deliver that better experience for the patient. And it's just kind of overall is going to impact how you're going to practice it all together. And then, of course, I'm hoping that as I'm going through this webinar, some of these things you're going to see, you're going to kind of go, wow, I don't do that because you didn't, it's not that you don't know how to do it, it's because you didn't have the right tool to do it. So I'm hoping that we can show you some of that as well. Given said all that, the amazing thing about 9.3 micron CO2 laser that I'm talking about today, it is very simple to use. So it doesn't matter how good the technology is. If it is difficult to use, you're not going to use it because it's too complicated. So in order for things to work well, you got to make sure that this is something that you can just grab and go. And that, I would say, is what this laser is all about. The good thing about this is that all those physics and whatever that we're going to talk about with the laser, it's all in the computer. It's already all set for you. Most frequent question I hear sometimes is, what is the setting for certain things? Because those of you who already had some experience with a laser, you know what I'm talking about. There's always like a setting for certain procedures that you have to match up. With this laser, very different. It's a parameter that we start with, and you give more to cut more, you give less to cut less. So, and then that speed is controlled by your foot pedal, which is a rheostat, which what we're already used to. So very intuitive, very simple, and it kind of really helps you to know how to engage of those tissues that you're working with, because again, it's going to give you the feedback and you're going to respond back and being able to know what to give, what to pull back. And all that stuff is already all built in. So all you have to do is look and see what you're cutting, give more if you need to cut more, give less if you need to cut less. So pretty easy in that way. So I'm one of the trainers for conversion. And I always see when I work with the doctors, from the beginning of the training day, they're just so nervous about even cutting a tooth. And then by the first one or the second one, so easy, they're done it. It's not, we're not teaching you how to do dentistry. We're just helping you to learn a different tool that you can implement to your practice. So by the time the end of the day of this 1 day training, we expect you to be fully comfortable with the laser. And then when you get back to your practice, you're actually going to be seeing patients next day. So very simple. The learning curve is very quick. And you're going to find that is one of the easiest tools that you're going to be learning to use, especially if you're used to technology. You know how that is. You're trying to get technology implemented to your practice, it's a process. But Solea, I think, has it very easy, and it's going to be amazingly easy and simple for you to be able to use. So all this comes because it's that wavelength of 9.3 microns that are getting optimally absorbed in hydroxyapatite and water, and also collagen for the soft tissue part of it. And then overall, it also gets absorbed to the plastics. It's the fourth element to it. So if you think about hydroxyapatite, water, collagen, and plastic, those are basically all the elements, all the chromophores that we're working with in the mouth. That's why it's an all tissue laser, and that's why it works so well. And then how it gets absorbed, because of the peak absorption happens at the 9.3 micron, makes it that you can have that fast, smooth cutting, and that's going to be so effective. And you're going to have that achievement of the analgesic effect at the same time too. So when we are talking about the hard tissue applications, then anything that you can actually think of that hard tissue is involved that has hydroxyapatite in it and that is tooth related and that's bone related, that's all in the mouth. That's what we're doing. So you can go anywhere from bone remodeling of alveoloplasty all the way to, obviously having your basic restorations. And especially the basic restorations part is when you can actually do this anesthesia-free dentistry. So let's look at the very basic part of it. Patient comes in and has this occlusal cavity that patient needs to be done. Your normal process would be get the patient ready in the chair, medical history update and whatnot, get the patient numb, wait for them to get numb, and then you prep and then you restore. What's going to change in that paradigm shift of what we're going to do with the laser dentistry is that patient sits, we get everything set up, patient knows what needs to be done. We use a laser, we prep the tooth, and then now we're restoring it, and that's it. So in a sense, it's very easy for the patient because they're not getting numb. And in a sense, it's very easy for you because you're not having to get the patient numb. So it cuts the chair time down almost by half. So something like this, patient occlusal coming in, it's literally 5 minutes in and out because it's so quick and so simple. A lot of times when I have class 2s like MODO combinations, I can prep that in about a minute or so, and then we restore. So usually in about 15-minute time slots that you can get that done pretty easily and pretty quickly. So it's going to cut down the time of what you need to do for the patient very quick. And then of course, the best part about the whole thing is that patient is not numb. So there's no post-op issues that you're going to having to deal with it later that you have to say, oh, once the numbing wears out, let me know how it feels. The bite may be off, but you got to wait till the numbing wears out before you call me back. Especially when I do a lot of quad dentistry, I used to be able to not able to really know exactly how a patient is biting at when they leave because they're numb in a full quad or even multiple quads sometimes when they're numb. I always had to get a post-op post-op appointments for the patients because I got to check the bite and I got to make sure. So when you already have the patients that are going to know how everything is going to feel before they leave, it's so much easier. So their bite is checked, everything is good to go. And then if they have any sensitivities, you're going to treat that right away. So there's minimum of post-op discomfort. The whole aspect of how this laser works is minimally invasive. So the way that you prep is 2 micron at a time, prepping down. So there's a very little of a collateral damage that's going to be created in that spot. So all these preps that you're going to be doing, patients are going to have minimal sensitivities even with that because you're not having that 400,000 RPM that's spinning around, hitting, and then all those collateral damages it's creating microscopically. You don't have that because it is just very conservative as you're moving down with it. Very clean prep. And not only you're prepping the hard tissue, you're also prepping the soft tissue at the same time too. So when you have a sub-G cavities like this, you can sculpt the tissue and create the gingivoplasty that you need to have it done in order to expose that margin. So that's huge, right? Being able to have that soft tissue, you're able to cut without bleeding, so you can actually do that final restorations without worrying about having that contamination happening. So I think you're going to notice that it's going to make your job so much easier when you can control that hard tissue and soft tissue to that very concise, precise manner of how you're going to prep that area. Not only that, just because the way that it is working, it's hitting that 2 micron at a time of the area. And each time that it's delivering the pulse, within that pulse, you're already hitting about 1100 hertz, which is about 1100 pulsation per second. So you're also creating that micro etching effect, increasing the bond strength. I'm just going to show you the paper that kind of shows that. So not only you're creating that increased bond strength, you're also creating the sterilization effect because the laser hits that spot for about 100 degrees Celsius. So you're automatically creating that sterilization effect for that area. So it also increases decreases the chance of the recurrent caries because you're creating that sterile effect for that area anyway. So there are multiple benefits that you're going to see by having a laser dentistry done for your patients. So moving on to the soft tissue then. Same thing, that same 9.3 micron laser has a very good absorption level to the collagen level. And not only it gets to absorb really well to the collagen level, it's the depth of it. We're cutting it about 2 micron at a time. You're at the level of lamina propria level. So you're actually at the level of blood vessel where you're actually creating that collagen contraction. So as you are layering the soft tissue cut you're having, and I even hate to say a cut because you're not really cutting per se, you're sculpting the layers away. You're able to control to make sure that you can actually have a full incision, excision type of procedures go, or you can do layers and then actually create the contouring effect that you're having. And all that, you can kind of do that. You can achieve that without bleeding. So when you can actually control the soft tissue the way that you want to control without bleeding, that's going to make your life so much easier, especially when you're going to combine that with hard tissue, any cosmetic work that you want to do. So for me, the soft tissue, sky's the limit. You got anything from gingivectomy, gingivoplasty to gingival troughing, all the way to pocket debridement, to denture sore treatments, to biopsies. And sometimes because you're able to deliver the energy without cutting, you're actually able to do some pain controls. And so I use it for burning tongue syndrome, burning mouth syndrome. It's, as I said, it's like the soft tissue, you're going to love it because it's one of really amazing. I mean, CO2 laser in general is a gold standard for soft tissue. So having to combine that wavelength works together with a CO2 laser, you just kind of got the best of the both world that you have. So something like this, if you're doing frenectomies already, great. I think a lot of people do with the diode. It's going to be a complete different animal when you're able to do with the CO2 laser. Even if you're doing with the erbium laser, which is an amazing soft tissue laser too, you're going to see the CO2 just delivers a different level of a cut and different level of healing for the patients too. Very simple, very easy, very quick. Something like this, when you're able to do these type of things without having to worry about even suturing afterwards, it's so much easier for the patient and it's so much easier for you as well too. So you're going to notice you're going to be able to do a lot of these things that you may not be doing right now that you're able to do. So this is a simple of lingual frenectomy of a patient of mine who I actually sent her out to an oral surgeon to have a frenectomy done. 6 months later, when I saw her in the chair, she still had a tongue tie. I asked mom, like, what happened? And she freaked out at the office because the thought of having the cut with the scissors, she just did not like it. And she just ran out of the office. So I said, I just have this laser that I can work with her. There's no suture. There's no actual, the scalpel effect that's going to happen. Is it okay if I do that? And mom said, go ahead and do that. So that's her. So you see that top right corner, how much of a tongue that she had to tie. And then after release, it's immediate post-op. She's able to stick it right out when she said, oh, Dr. Kim, my tongue grew. Well, it didn't grow, but she's now able to use it more and better. So this is like a perfect example, something very simple. Procedure like this, you can actually do it out of hygiene because it's so easy. I mean, I put a little bit of a topical for about a minute or so in that area, and then you laser it. You just saw the video, how quick it is. And then there's the minimum post-op that we have to worry about. Even when you do something like this, a biopsy, this is something very simple that you can do. You're actually excising the tissue. The whole thing is when you're working in anywhere in the mouth, very vascular, right? Especially tongue. So sometimes when you take a scalpel over there, you're going to get a lot of bleeding. But see how little of bleeding we're getting because we're coagulating as we're cutting. So that's the beauty of it. Because then even think about like if you were to do regular biopsy with a scalpel, and if you have to do a suture in that area, I mean, that's very uncomfortable, especially at the tongue when patient has to talk. And so all these functions that we're having with the patients, if you have something that's going to be working really well in order to create the good effect for the patients, that's going to be reducing this post-op discomfort, anything that can make things easy, that they can get right back into their normal routine. The acceptance level for the treatment is going to be so simple too. That procedure that we just saw, if you told the patient, yep, we're going to cut, you're going to bleed, we're going to have the suture, you're going to come back for suture removal. I mean, who's going to want to do that? But where you say, no, it's going to only take me about a minute, there's going to be 0 to none post-op discomfort and there's no suture. And you can pretty much go back to what you needed to do, go answer calls or drink coffee or whatever you need to do. They're ready to do that. So it's being able to provide that care that patient can actually accept that treatment very readily. I think it's also important too. So then what you saw, just those two slides that we showed you, the video that I showed you, is about how we're ablating the tissue. We're actually cutting the tissue, but this is actually what we're not cutting the tissue, but delivering the energy in order to create the denaturization effect. So this is after ulcer treatment. So a patient comes in, canker sore, any type of those soreness that they have, that it's so uncomfortable. What we're doing is we're delivering the energy. We're not really cutting. We're not cutting anything away, but we're delivering the energy to make sure that we're creating that energetic effect for the patient and also to heal that spot, right? Because we're having that laser to hit that spot and then also the photobiomodulation at the same time to heal that area. Very easy, very simple. These are very simple procedure to do. Great service for the patient. So nowadays, when I have patients calling in and saying, "Oh, I need to cancel appointment because I just have this ulcer developing," my admin people will say, "That is perfect. I'm so glad that you called. I need you to come in because Dr. Kim can actually treat that area for you." And we will. And then we can move on with the procedure that we need to do for the patient. So again, it's when you're kind of flipping that, it's actually helping it so you can make sure that patient is getting good care. But then also for you, you're not losing your chair time, you're not losing your production. So kind of a good thing on both ends. So very exciting for this type of a versatility that this laser can provide. So when we talk about aesthetics, even cosmetics, what we're looking at is the symmetry, right? So when we have something like this, when patient is coming in and saying, "I don't like the color of this bonding that I have," what they're really truly saying is not so much of the bonding, but they're also looking at that curtaining effect of the soft tissue, right? So you can do a beautiful resin all over again, but they're still going to say, I don't know. Like, it looks nice. The color match is perfect, but they may not really like the looks of it. They don't know why, but we do know why. It's because of the symmetry of the architecture of the gum tissue that we're looking at. So when you can actually do this type of procedures where you can easily sculpt the tissue without bleeding, so you can do the same day the hard tissue procedures, that's where the value comes in, because you don't want to have the crown lengthening type of things happening that you have to wait, you have to have the patient wait for 3 or 4 months to heal before you can deliver the final, especially for the front teeth. So the beauty of it is when you can actually sculpt that tissue really nicely, you're actually able to deliver that hard tissue, whatever you actually are trying to deliver at the end, right there at the same time. And again, increases the patient satisfaction. It reduces your chair time, and then it also gives a good clinical outcome for the patient. So I think those are the type of things that I do in order to make sure the patient is satisfied. So something like this, patient comes in, gummy smile, very unhappy. She's a 14-year-old, just came out of ortho, doesn't really want to smile. But when you're able to do something like this, is immediate post-op. We just sculpt the tissue, gingivectomy, clean it all up. 6 months post-op, looking beautiful. These are the very easy process for me right now. If you don't have the right tool, like the CO2 laser, then it's going to be a very difficult process for you to handle. And it's a very long, arduous process of healing for the patient. So it's just making sure that you're delivering good clinical care in an efficient manner to give that happy smile for the patient. So that's really what it comes down to. This is my very first crown lengthening case that I did with my patient. When I first got my Solea, patient came in, broke a tooth, just wanted to extract because he actually had experienced crown lengthening before, and he decided he's never going to do that again. So for me, I said, well, if you're going to extract the teeth anyway, I just got this laser that I'm supposed to be able to do crown lengthening. Can I do the crown lengthening for you? And if it doesn't work, then I'll extract it for free. You know, like you got to have the first experience because you got to know how this is going to work. So this was actually a perfect case for me. So I did, and patient agreed. So we did the crown lengthening. And this is x-ray 5 years later. So crown was done. Everything looks great. Tissue looks great. Patient's happy. But do you see how there's no root canal done on that? I mean, we did the pulp cap on that tooth. And I actually told him at the time, I was like, this may actually need a root canal down the road. Good thing about Solea is because it can give the sterilization effect. If you're treating that pulp cap area, you can really create that sterilization effect. So you can make sure that things are not getting reinfected in that area, and also really be able to treat that spot so the patient is not having pain. So I'm not saying that this patient will never need a root canal. In fact, I think just last year, he had the number 18, had the root canal treatment done. And he was aware of it because he knew when he came in at the time, root canal was obviously in a treatment plan. But it brought him the vitality of the tooth for many years, about 8 years before we actually have to do something for that number 18. So again, delivering that quality care, delivering that best care that you can. Something like this, very simple. You can remove the tissue really easily, and then being able to remove the tissue and then being able to get to the tooth underneath in order for you to access that area to clean. I think you're going to see these type of things over and over now. This is a case where the bottom middle, that's how patient came in. Had a pain, recurrent caries on their old crown. When I removed it, that's what I saw. So traditionally, what I would do then is we got to do a crown lengthening, temporize it over and over, and then heal, and then rebuild, and then we actually get the crown back on. So what we did was we treated a tooth, did a crown lengthening right away. So the bottom middle to the bottom left, that procedure, like in between right there with a soft tissue management and build up and then getting it ready for it to be scanned, took about 15 minutes. And then I was able to scan because you can see the very good margin in that area. While the crown is being milled, he had all these other broken teeth and cavity areas that I had to fix. So I went ahead and fixed all that. By the time crown was done, we inserted, resin was all done, and then we were good to go. So this whole process of crown buildup, crown lengthening, insert, and four or five restorations that we did, everything took about 1 hour and 45 minutes. That's efficiency and that's production. And this procedure, crown alone, could have taken you 3 to 4 months in order to complete. So just kind of putting things into perspective as to what happens when you actually have a tool that's going to work really well, that's going to help you. This is a patient who came in, number 9, popped off, resin popped off. He's a salesperson. He wanted something that's built back on. Obviously, there's more issue going on than just the number 9 getting back on. So this is a case where we actually had to do an extensive crown lengthening procedure done. And he wasn't going to do it because he's a salesperson. That 3 to 4 months downtime, even 7 days of healing time from the initial surgery, he just wasn't going to do it. But when we had the laser, that we were able to say, hey, we can do this on the same day. I think we did the whole, the prep from 3 to 14 and getting the temporization going with the soft tissue management took about 4 hours. And he was right back on in order to do whatever he needed to do. So when you actually think about all those things, you're going to start to notice how when you have a good tool, when you have a tool that's really flexible and versatile, it's going to infuse into everything that you're doing. And then it's going to help you to do things better and faster and more. So that's the tool, right? You don't have to worry about like, do I have the right tool? Do I have to pull this? I mean, I used to have different lasers and different things that even my assistant's like, well, what am I setting up for? And I'm like, just set up everything because I may need it. That's not the case anymore. So that's the easiest thing that you can think about. It's kind of streamlining what you're doing. That in itself will bring an efficiency for you. So those are the things that you already do that you're able to do better and more efficiently, and then be able to get better clinical outcome. Let's think about something different. Like what else can we bring to you? So if some of these things are you're seeing and you're kind of checking things off, goes, I do everything. Awesome. If you're looking at it going, oh, no, I don't do that. I don't do that. I refer those things out. Ooh, it'll be great that if I just keep that in-house, then you're able to, because now you have the tool that you can do it. So just kind of think of some of these things, even implant exposures. So for me now, I would expose implant. I will sculpt the tissue because the laser can actually create that emergence profile for me. I'm able to put a scan body in, scan, and I'm milling, and then I'm inserting. So instead of patient having a tissue punch, healing cap, waiting for 2 weeks or plus, come back, take this impression scan, and then, coming back, we're just making things so much easier and quicker for the patient. And I think the downside of all this is a lot of my patients are so used to same-day dentistry. They come in, they know things are going to be fixed, and then they're going to walk out, which is great. And then that's kind of what you want to drive anyway, because I always feel the chair time that you're not producing is not a good thing. So you always want to have the systems and protocols of how you're going to flow and be able to have the right tools and right technologies for you to be able to really push that. So I think when it's all said and done, those are the things that you can see, and things that you're not doing, that you're able to do, things that you wanted to do, that you couldn't do, now you're able to do, those things that you can all incorporate it. And then there's this new aspect of it, right? So one of the things that this 9.3 micron CO2 laser can do is that it can also treat snore. So remember, we talked about how there's an ablative nature of the laser, and then there's just delivering the energy. This is a different level. We're actually affecting the area of the collagen, delivering the energy. And actually, the easiest way for me to describe it is kind of creating a wrinkle therapy for the back of the palate area to reduce the palatal snore. So It's simple, it's easy, it's not cutting anything. I know sometimes my patients, when I talk about the lasering for the snoring, they're like, what are you cutting away? Because they're thinking like UP3. It's not that. We're actually delivering the energy to the back of the throat from the junction of a hard and soft palate all the way down palatal gloss arches down to uvula, really creating that energy to be delivered to that spot and then create the collagen contraction. That's what we're doing. And it then lifts up the tissue, opens up the airway a little bit, and then it also reduces the palatal snore. It's not an appliance. It's not a surgery. It's very easy. I usually put topical spray on the back of the throat to really reduce the gagging for the patients. Usually about a 5 minute of lasing, really simple. A lot of the patients actually get results within the first night too. I also find it now, I've been doing it for a while, this works really well in conjunction with people who are also using either appliance or even CPAPs and things like that. It doesn't treat OSA. This is not a treatment for OSA, but I find that it's a good adjunct for the patients as well too. So it works really well. I think it is something that I mean, everybody's thrilled in my practice about, and I have some patients who are just really hate that CPAP, even though they have OSAs and they won't comply. But at the same time, they like to do something like this because it does help them. And, you know, tons of people who have OSA still snores and still have those issues too. So again, it's something that you can really implement in your practice to help your patients. This is the immediate post-op photos. And just like that, you kind of being able to get that Malan-Party score to open up a little more for the patients. I think this is a more life-changing thing for the patients too, right? Because it's not just about us fixing cavities or, you know, restoring teeth, but this is about their health, their own. I mean, sleep is important. Snoring is kind of something that obstructs the people's airway in that way too. Again, it's something that I think a very good thing that you can implement to your practice and be able to do. I think we have doctors who actually just do this. I mean, doctors who get Solea just to do this for their practice. So this is one of my patients. I'm going to have you listen to his testimonial.
My name is Herb Hamilton, and I'm from Elverson, Pennsylvania. The snoring in my life has definitely affected my sleep patterns. It started with me not exactly having as much energy in the morning as I was used to, but the final confirmation that I received from my wife, normally via elbows into the ribs in the middle of the night when I would snore and wake her up.
Herb and I have been married for a number of years. He would roll onto his back and it would sound like the ceiling was going to be lifted by the volume of his snoring.
I would be snoring so loudly, and you finally had enough. It's like, no, that's it. And you're pushing me right out of the bed saying, go sleep on the couch. When I was getting my examination, Dr. Kim asked me about snoring and asked if, did I snore, or had my wife mentioned to me that I snored. And I was really surprised. I honestly thought Anita must have called. When Dr. Kim mentioned the Solea sleep to me, I was surprised. I had never heard anything like this. She described it as a very short procedure and that it wouldn't be painful. It would be very quick and easy. And it was. There was no pain whatsoever. After the procedure, the Solea sleep therapy procedure was completed, I went home and I didn't tell my wife, and I didn't tell her on purpose because I wanted to make sure that the therapy actually worked. The next morning, when I got up, I asked Anita, I said, hey, by the way, did you notice me snoring any less last night, or was it the same? And she said, now that you mention it, you didn't wake me up once.
I'm absolutely getting better sleep, but it's because he's not waking me up.
Well, I think one of the things that really intrigued me was how it would benefit you, because if I stopped snoring, you would actually get a good night's sleep. I know, right?
Like everything you do.
This therapy has changed my life. My sleep has improved. I'm not snoring. I have more energy in the morning. My wife's sleeping better. I think that's probably one of the more important things. So I think if you snore, I would highly recommend this Solea sleep therapy so that you can get on with your life and sleep better.
So you're going to actually hear a lot of those type of testimonials from your patients too. You'll be surprised how many times you're actually playing the relationship therapist when you're introducing Solea Sleep. So that's, again, I don't think a lot of doctors actually are aware of it, and then being able to do this, and it's such a great service for the patient. So I think even by itself, that works really well. So then let's talk about what it means to deliver that efficiency for your practice. Obviously, you're going to start to see things that are going to be working so much better because you're able to reduce the time that you have to introduce that anesthesia for the patients, because you're able to deliver that anesthesia-free dentistry, not having to worry about all these bleeding of the soft tissue that you have to maneuver. Your life just becomes so much easier when you have to not deal with all that. We talked about how it's going to be increasing the acceptance of the cases because, again, it's easier, quicker, and simpler for the patients. Just even when you're telling them this time period that it's going to take to do certain things, my patients are so used to having things done in such an efficient manner. Like even if they're scheduled for 5, 6, 7 restorations, they're usually done within 30 to 45 minutes. So when they go to another practice or whatnot, and it's like 2, 3 hours or something like that for the same amount of things that we're doing, they all of a sudden start to realize the benefit of having some type of technology like this that helps us to become more efficient. You're able to keep more procedures in-house. You're able to do more things in the same day. So that way, again, saving you and your patients time, and then being able to do more, that's going to really, you're going to notice how much more of the stuff you can do. So even when you do like those class 5s that are sub-G, when you're doing that gingivoplasty, that's an additional procedure that you're going to be filling out for the patient. So because you did it and you are doing it, and it's good for the patient, it's good for the clinical outcome for you, but ultimately at the end, it's going to bring in that revenue that you, because you did the work. So I think you're going to see, by being able to utilize this technology, it's just going to make things easier. You're going to see how sometimes something like this, when you're bringing stuff right from your hygiene appointment, because you're able to do things without getting the patient numb. When a patient is in your chair and then you diagnose something simple, like, a couple cavities or whatever that you need to get done, or even like biopsy of the things that we just saw, or they have this little mucocele that they're biting on, or a fibroma that was caused by the trauma that patient was biting all the time. When you offer to get those work done, usually the first thing they ask is, how long is it going to take? Do I have to get numb? Can I eat or drink right away? So when you say, it's probably going to take me about 5 to 10 minutes or 15 minutes, depending on how long that's going to be. You just saw the restoration video of how quickly that you can do that without having to get the patient numb. And then you can say, there's no really post-op discomfort. You're not getting numb, so there's no post-op issues that you have to worry about. And yes, you can just go on with your life and move on to whatever this is. When you get back, you can get back on the phone. You can go, get a coffee, a cup of coffee or something. It becomes like such a no-brainer. They're already there. They're like, oh yeah, let's just do it. So I would say like 99, 98% of the time when we offer, like, do you want to just stay and get this done? It's going to be only taking about 15, 20 minutes of extra time. And then there's no numbing after, and then you don't have to come back for this. They, without a doubt, want to get done. So a lot of times we ended up pulling patients from same-day dentistry because you can just really do that. So I think you're going to see that. I mean, that's how you want to drive your schedule that way, right? So I always think it's something that you have to see how your day's working, and how you want to create that efficiency is up to you. But you don't want to be working harder in order to create that efficiency. You want to literally work efficiently by pivoting this technology to be able to get that implemented to your practice. So let's talk about this anesthesia-free part, because I've been talking about how you can be more efficient because you can cut down on the time the patient is you have to get the patient numb, and the patient had to wait for getting numb. So when I got my laser, I was doing about 3,000 or so restorative procedures. And obviously, correspondingly, I was buying that much of anesthetic carpules. As soon as I installed Solea, within like 2 months, I was having some of these anesthetic carpules that are expiring, that my staff member was bringing up to me and goes, oh, Dr. Kim, what do I do about this? I'm like, what do you mean? Like, we're doing so much work. Why are these supplies getting expired? What we realized then when we went back, we were doing so much more procedures because all the efficiencies that I just talked about, but anesthetic carpules that I was buying went down about 78%. So when we actually look at the number, we actually went 98+% anesthesia free on the stuff that we were doing. amazing and great experience for the patient as well too. So it truly is that. So when you're eliminating some of these things that we were talking about, the needles, the things that patients don't like, the sound of a drill, the post-op discomfort and sensitivity that patient's going to have, the long length of the post-op discomfort that patient's going to have, the soft tissue trauma that they have to heal from. If you can get rid of all these different things for the patients, you're actually driving yourself to create that better experience for the patient. And ultimately, what actually grows your practice? It's not your clinical skills. It doesn't matter how good you are. If your patient's not there, it's not gonna. If patients don't talk about how well you're doing and how good you're doing and how much they enjoy the experience of they're with you, your practice is not going to grow. That I actually don't do marketing. I don't advertise at all because they advertise themselves. This is what my patients do. Whenever they have experience in my office, they're putting these postings out themselves. And you'll be surprised nowadays. I guess you're not surprised, actually. Everybody talks about everything, right? So if they have a good experience like this, they're going to talk about it. What do you want people to say? You want people to say, I am never going anywhere else, because the experience that they're going to get my practice, they're not going to get anywhere else. So I think having these technologies, patients are going to know. They know it. They know you deliver this type of care. And when they can say, I came in, I came out, I'm a huge fan, and they become a fan of yours, this is what drives your practice. This is what's going to grow your practice. This is what's going to energize your practice. So I think this is something that you're going to, if we all want to grow our practices, I think the moment that you say, I'm not accepting new patients or I don't want my patients, that's when you're going to start to see the decline of your practice. But ultimately, if you want to do better and you want to do more, you want to serve your community better and all those things that we want to be, because this is why we're doing what we're doing. This is what you're all about, right? Patient notices your technology. They notice what you're doing. They notice how things are going. They will always comment on things and they'll notice things and they'll be thankful for what you're doing for them. And they become your lifetime patients. And they don't, I have frequently patients who move away like 2-3 hours, still come to me because they know we provide the best care for the patient, giving the up-to-date technology that we have. They recognize it. They understand we're the top notch. That's why they are there for.
So today I came to see Dr. Kim to have a cavity filled, which is not one of my favorite things to do. Typically, it involves lots of Novocaine for me. Today, Dr. Kim talked to me about a new procedure called a Solea laser. I didn't know what to expect. I knew nothing about what this laser was. I was a little nervous. So we started with the Solea, and the first thing, there was no Novocaine at all, which just threw me over the top. She started with the procedure, and I think we were done in about 15 minutes. And you have that whole time you're getting the procedure done, you're feeling like, okay, what's next? There's got to be something more. It's going to hurt somewhere. Something's going to happen. Nothing. There's no pain. There's no Novocaine. She didn't need to stop and give me more Novocaine because I was feeling pain. And I couldn't wait to go home and tell my husband about this amazing procedure that I had done, and thinking ahead for my children who won't have to ever face another needle.
That's actually what I'm excited about, because it's talking about how we're changing how dentistry is viewed. I remember when I was in dental school, we took a course called Dentistry and Social Media, and it was about like Marathon Man and Little Shop of Horror, like basically all about how this media portrayal of dentists being just awful people. And I think that's what people think about. People come in, they have fear, all these bad experiences they have made them denophobes. And that's the emotional parts that we're dealing with. But when we can actually get rid of all that and being able to change that and actually make it so that it is fun for them, I guess I don't know about so much of a fun, but makes the experience so much better, because you're getting rid of all those things that's creating the barrier for what we're doing and then what we need to deliver to the patients. I think that's how things are going to change. That's how we're going to elevate the next standard of the dentistry. That's going to be a new wave of what we're going to bring into the patients. Ultimately, happy patients, happy parents, happy, people around you, they're going to really drive people back to you. And that's what's going to drive your practice. So, I want people to say it was best dental visit ever. It makes me smile. I love my dentist. I think those are the type of things, those are the energies that you want to have. And in turn, you're actually doing better clinical dentistry. You're providing better care, new procedures. do you see the synergy of how things are all affected by having something like 9.3 micron laser that's going to be a game changer for your practice? Because that's really going to turn things around for you. So I think the reason that I wanted to bring this all to you this evening is because of all the stuff that we were talking about. Obviously, I want to be a better dentist. I want to always be better. I want to always improve. So I want to make sure that everything I do has a better clinical outcome. I want to always learn more stuff. There are more stuff that's out there. I want my patients to know there are more stuff. And the day that patients bring me that what I don't know that's out there, oh my gosh, that would be so embarrassing for me. So I always want to stay on top of things and being able to know what's out there and be able to provide that for the patient. And in turn, I think that also provides a new revenue source for me. It's better because I'm creating the efficiency. I'm doing things better and faster for the patient. It's better for the patient. Nobody wants to sit in that chair forever. And ultimately, all of this makes it a great experience for the patient that then creates a fun environment for everybody. So I think in general, in any situations, in a moment of decision, I love this quote. The best thing you can do is the right thing, obviously. The next best thing is to do the wrong thing because you can learn from it. But the worst thing you can do is doing nothing. So you're just watching things go by and seeing these developments and where things are. I'm glad you're here. I'm glad you're kind of hearing about this. I'm sure you heard about it before. Maybe I'm hoping that you get to learn things more and then you get to hear more things. I'm just hoping that this kind of enlightens you about some of these technology that's out there that's going to bring some different light to what you're doing and how you're doing. And I guess if tomorrow you're sitting in the chair and doing your dentistry and you're kind of thinking, well, if I had a 9.3 micron laser, maybe I could have done this. If that tinkers your brain, I think I've done my job because I wanted to make sure that you're understanding that there's this type of technology out there that is really a game changer for what you're doing on a day-to-day basis. Okay, I spoke a lot, which I tend to do. I'm going to answer some questions. So we can certainly go ahead and post them, and then we can answer those questions.
Thank you, Dr. Kim. We got a few questions here. First up, is there any dental code we can use? And I guess this is in regard to Solea.
So I don't use different dental code for Solea. What you do is what it is. So if you're doing cavity prep, those are the actual, the restorative code. And if you're doing gingivectomy or anything like that, that's the same code. If you're doing any type of excisions, there's an excisional code. So it's still the same CDT code. I do know a couple doctors who have used Solea laser as like a behavioral management type of things because, some people with the denophobes, instead of being sedated, this is what's being used. So I guess, you have to kind of pick and choose if that is, but there is no different specific dental code for the laser use. It's still the procedure that you're doing.
Thanks. Next up, difference between Solea and erbium YAG laser.
Yeah, so erbium laser, great laser also, does great work for the soft tissue, and it also can cut hard tissue too. The difference is the wavelength. So Solea laser is 9.3 micron. So if you remember the slide that I showed you where the maximum absorption of that 9.3 micron gets absorbed to hydroxyapatite, water, and collagen, that's what makes it very effective in terms of how it's cutting. Another difference is the depth of cutting. So some of those other lasers cut in a bigger depth, like a 20 microns or plus. Solea laser cuts at 2 micron at a time. So it's a light tap and then it's crowning down at all times. So you're creating a very gentle way of cutting things rather than cutting this big bulk of the energy, bolus of energy that's cutting to the area. So that light tap, like 2 micron at a time that's going down, that's actually what creates the energetic effect for the patient. So that's where the difference is in that.
Great. Next up, are there any videos on a crown prep, and how long is your average prep?
So yes, there is. So one thing to remember about Solea laser, and in any type of laser, it's their end cutting device. So for a crown prep, it is going to be more efficient for you to cut with your diamond burr because then you're able to cut axially and at the end cutting as well too. But I have done crown prep with the Solea where I would crown down up to like a height of contour, create that energetic effect for the patient, and then finish up with a burr. because there are some patients who absolutely do not want to get numb. And I understand that. So it takes me longer to do the crown prep with Solea because you're strictly end cutting. But there are sometimes I would do it because I know that patient would get a better result of not having to be numb for that. On average, if I were to do regular crown prep with the burr, it probably takes me about 5 to 7 minutes at max to cut a full crown. When I do with a laser, it takes me about double the time. But if I were to do it all the way through and then finishing up because I've done that too. But what I learned is a compromise. So I would use a laser to cut about the half of about the height of contour, get the analgesic effect going, and then I'll finish it with a burr. So then that takes me about 2 more minutes or so, I would say, if I have to really put to it.
Great. Next up, which procedures are totally anesthesia free?
Any of the carious restorations. So class 1, class 5, class 2, class 4, class 3, like all those things that I'm doing are pretty much anesthesia free. There are going to be some patients who are going to be sensitive no matter what. So what I do is before I start, I actually try to figure out how patient is going to be sensitive. This laser is pain-free, but not sensation-free, meaning that they are going to feel that air and water that they're going to have because you're going to have that mist, you're going to have that air. So if the patient is already sensitive, and then as you're going in, they go, oh, I can't handle that anymore, or I can't even handle that period. And when I breathe, it's painful, then you may want to get the patient numb because they're going to be uncomfortable. If they can tolerate that initial stage of about maybe 30 seconds or so of onboarding of the analgesic effect, then they get numb and they're good to go. There are also ways to, like, you remember that after ulcer video that I showed you? When you do that laser effect to the soft tissue, you're treating like the after ulcer treatment. When I do that low level energy that I'm delivering to the hard tissue, that it also creates desensitization effect. So like those patients with the effraction, the sensitivity, instead of doing like vanish or fluoride, sometimes I will use a laser to occlude that dentinal tubule surface to decrease the sensitivity. So there are kind of different ways of going about it. Different Solea doctors obviously do different ways of controlling that. But I would say most of all, like basic restorative procedures, I'm doing anesthesia free. The bone, I'm already having the patient numb because if I'm going to be flapping that area or doing the crown prep or the crown lengthening, patient's already numb, so I would get the numb. If I'm doing like a tori removal, yeah, I would get the patient numb because I'm going to open up the flap. If you're doing closed flap crown open flap crown lengthening, the actual crown lengthening that you're thinking of, then I would get the patient numb for that. But you're still getting a benefit of having that the blood free or the minimum of blood that you're going to have when you're doing that. It's amazing when you do that incision and there's almost no blood, and then you get the exposure of what you need to do. It's so much cleaner and better for the patient and for you as well.
Awesome. Next up, do you use a traditional drill in your practice anymore or only the laser?
Great question. You're not replacing your drills. Your drills you still need them in order to finish your restorations and polish and all that stuff too. So cases like, say, like if you have a class 2 and then you have an undercut, again, laser beam is straight, it's not going to bend, and it's an end cutting device. So sometimes you may even have to involve your handpiece in order to finish up that prep in order to kind of get that undercut out of the way. So what happens at that point is patient does have analgesic effect on board. So you don't have to get patient numb, like additionally with like needles or anything. You just have to let the patient know you're going to feel just a little vibration. Because again, it's pain-free, but not sensation-free. So up until the point you're using Solea and you're prepping the tooth, patient doesn't really, nothing's touching the teeth. So they don't even know sometimes the tooth is being prepped. Frequently, I prep and then I'm ready to restore. And I'm like, okay, now we're going to go ahead and put the filling on. They're like, what did you just do? And I used to tell them, like, put your tongue up there. And then they go, oh my gosh, I didn't even feel a thing. So they don't even know because nothing's touching the tooth. But the moment that you put the handpiece or a drill onto the tooth, they're going to feel that vibration. Not so much of a pain. They're going to know that there's something is touching the tooth. So I usually have to tell the patient for you to be able to check and see if, like, I'm a very tactile person. So if I want to check if all the decay is gone, I would actually take a spoon excavator and then really clean that. So if I'm doing those type of instrumentations, I also let the patient know you're going to feel a little pressure. So that way they know something is touching. But in general senses of things, yes, you still need a handpiece because you still have to finish up your restorations and then clean up.
Awesome. Next up, can the Solea laser be used for periodontal surgical procedures like osteoplasty, LNAP, etc.?
So the you definitely can do, because I feel that Solea is one of the best thing that I could do sometimes when I do periimplantitis cases, because it's such a conservative laser as far as the use is concerned. It's so precise. You're even if you're able, even if you're touching like those implant areas and whatnot, it's 2 microns. I mean, it's so nice to have something that is so precise and then better control that you can do. So there are uses for some periodontal stuff. I would not be doing like I guess kind of Lynette-like procedures, because you don't have the way to. I mean, anything that you open, flap, and then doing things like that for perio. Yes, I think it's a very, you can get a very good use with that.
All right, we have a few more. Which laser is more efficient in hard tissue and soft tissue in handling CO2 or erbium YAG?
I mean, I would say CO2 hands down, because it is soft tissue, CO2 obviously hands down, and then having this particular wavelength is what's actually driving that hard tissue to be most effective. Again, it's all about laser dentistry is all about the wavelength.
Next up, how do you wear your loops and protective laser glasses?
Oh, great question. Great question. So you definitely need to wear a loop. We definitely need to wear the protective eyewear. That's for you, for your assistants, and for your patients. And I usually only have those 3 in the room. So if I have any helicopter parents or helicopter wives or girlfriends, boyfriends in that room, I usually tell them, it's a class for laser, you got to get out. So I just get them out of there. It comes with the inserts that if you have your own loop, it has an insert that goes with that. I have a built-in laser lens that is with my loop, so that you can certainly do it that way. I think the company actually, the laser comes with the eye protective wear for you, for your assistants, and for your patient. So, but it is OD7, so you got to make sure that you're wearing the right type of protection.
Awesome. All right, this should be the last one. What was training and or coaching like?
As a learner. So for me, when I first started, I had online video that I was watching, and then I had a 1-day training. And then, as I was explaining earlier, usually you start first cutting a tooth thinking, I don't even know what I'm looking at. I can't even see what I'm cutting. To by the time you cut 2 or 3 teeth into it, you're going, wow, this thing actually really works. And honestly, the next day, then you're seeing patients. My first day after Solea training, I saw about 10 patients. I particularly made sure that I was seeing mandibular occlusals, because I wanted to be able to see a direct vision, and I wanted something flat surface that I was able to know how to cut before I was going in for like number 14 MODBL kind of thing. So after I did about 10 of those procedures, felt pretty comfortable. Patient was doing great. I was feeling so confident. That night I stayed and cut about 6 or so teeth. I put them all together, extracted teeth, and I was practicing the class 2s, because that's a little bit more challenging, because you got different line angles that you got to look at for an end cutting device. After I cut that, I got the hang of, okay, this is how class 2 is going to work. Then the next day on, I said, okay, we're going to do everything. And then I never looked back. So I would say 99% of the doctors that I'm working with, that I help train and whatnot, it's the same thing. We see in the beginning, very timid. It's like, ooh, I'm not sure. I can't even see. If any of you have any type of a hands-on demo, you're going to see there's a lot of plume, and you're like, I can't really see what's going on. But that's just because you're on an extracted tooth. When you're in a patient's mouth, very different. And in everything it just clicks, because again, it's not about us teaching you how to do dentistry. You already know how to do that. It's just replacing that drill with the laser. That's going to be an end cutting device that's going 2 micron at a time. You're going to notice that you make that transition very quick, because again, you already know how to do dentistry. So it's about a day of a training. And I think by the time end of the day, you're going to feel pretty confident that you're going to be able to cut.
Great. Well, thank you, Dr. Kim, for your time, and thank you everyone for joining us. Have a great night.
Thank you.